Assalamu alaikum. I am Dr. Bulbul Hossain Shuvo, Assistant Professor, Department of Community Medicine in Bashundhara Ad-din Medical College. Today, I am going to be delivered a presentation on plague. What is plague? Plague is an infectious disease of animals, particularly wild and domestic rodents, which is transmitted to man through the bite of infected ectoparasite, the rat flea. This is also known as bubonic plague, black plague, and the Black Death. Epidemiological determinants. Agents of plague is causative agent, which is known as Yersinia pestis, is a gram-negative non-motile coccobacillus. Reservoir of plague is rodent. Rodents are the natural reservoir of plague. Sources of infection: infected rodent and the fleas and the cases of pneumonic plague. Host factors: age and sex. All ages and both sexes are susceptible. Immunity: the man has no natural immunity. Environmental factor: season. Outbreak of plague are usually seasonal in nature. In northern India, the plague season starts from September to May. Temperature and humidity: a mean temperature of plague is 20 to 25 degrees Celsius. Rainfall: heavy rainfall, especially in the rat fields, tend to flood the rat boats. The human dwellings: rat frequently dwellings house and where housing conditions are poor. Vector of plague: the commonest and the most efficient vector of plague is rat flea. Classification: here I have divided in two portions. Firstly, disease in man: bubonic plague, pneumonic plague, and septicemic plague. Bubonic plague: this is the most common type of plague in disease. Pneumonic plague is highly infectious and spreads from man to man by droplet infection. Septicemic plague: primary septicemic plague is rare except accidental laboratory infections. However, bubonic plague may develop into septicemic plague. Septicemic plague can occur as the first symptom of plague or may develop from untreated bubonic plague. Rodent plague: here has divided another two portions, wild plague and domestic plague. Incubation period: bubonic plague for 2 to 7 days, septicemic plague 2 to 7 days, and pneumonic plague 1 to 3 days. Mode of transmission: the bite of infected rodent flea, occasionally by direct infection, contact with the tissue of the infected animal, by droplet infection from case of pneumonic plague, and dissemination of plague by plague patient by bite of the human flea is a rare and exceptional occurrence. Transmission cycle: firstly, commensal rat flea to man. This is the basic cycle in epidemic bubonic plague. Wild rodent to fleas or direct contact to man. The disease is transmitted from rodent to rodent via wild rodent fleas or contaminated soil. Man contact the infection from infections wild rodent and fleas or by direct contact with the infected rodents. Wild rodents, peri-domestic rodent, wild rodent fleas, peri-domestic rodent fleas and commensal rodent fleas to man, then man to human flea to man, then man to man. And this is the picture of plague cycle. And then clinical feature. Clinical feature for bubonic plague: sudden onset of fever, headache, chills, weakness, one or more swelling and tender and painful lymph nodes. This is known as buboes. These form usually result from bite of infected flea. If patient is not treated with the appropriate antibiotics, the bacteria can spread to other parts of the body. Septicemic plague. The clinical feature would be fever, chills, extreme weakness, abdominal pain, shock, possibly bleeding into the skin and other organs. The skin and other tissue may turn into black and die, especially on fingers, toes and the nose. Pneumonic plague. Here clinical feature should be fever, headache, weakness, developing pneumonia with shortness of breath, chest pain, cough, bloody or watery mucus, and then pneumonia may occur to respiratory failure, then shock. Complication. Septicemia, DIC, convulsion, shock, and diffuse hemorrhagic change in the skin with cyanosis from the necrotizing pneumonia produce the dark skin at the extremities, giving rise to the term known as Black Death. What is block flea? A flea may ingest up to 0.5 cubic millimeter of blood, which may contain as many as 5,000 plague bacilli. The bacilli multiply enormously in the gut of the rat flea and may block the proventriculus so that no food can pass, and this condition is known as blocked flea. A particularly blocked flea is more dangerous than a completely blocked flea because it can live longer. Infected fleas may live up to an year, and certain species survive in the world's microclimate for as long as 4 years. And this is the picture of Black Death, and here has the history. I am now going to that portion. The Black Death or simply the plague was pandemic of unprecedented scale caused by bubonic plague that originated in China in 1334. According to the history of Black Death, where killed 60% of European population at that time. Many people believe that Black Death was a kind of divine punishment, retribution for sins of against God such as greed, blasphemy, heresy and fornication. The Black Death epidemic had run its course by early 1315s, but the plague repeated every few generations for centuries. According to the World Health Organization, there are still 1,000 to 3,000 cases of plague in every year, and this data is so alarming. How we can diagnose? Directly examination via sputum and blood, buboes aspirate via gram stain, Giemsa or Wesson stain, gram negative coccobacillus bipolar staining, and we can do culture, and it would be possible within 24 to 48 hours. Treatment. Plague can be treated by antibiotics of aminoglycoside, ciprofloxacin, doxycycline and chloramphenicol. Managing plague if outbreak condition occurs. Firstly, find and stop the sources of infection, then protect health workers, then ensure correct treatment, isolate patient with pneumonic plague, surveillance, obtain specimen, disinfection and ensure safe burial practice. How we can prevent and control of plague in epidemic condition? Control of rat population, control of rat flea by insecticide, vaccination. Here we can give 2 doses of vaccine. 2 doses of vaccine given at subcutaneously 0.5 ml and interval of 1 week, then 6 months at a booster dose. Chemoprophylaxis can be also used, tetracycline and sulfonamide for those who are exposed to risks for plague infection. Control of human case, early diagnosis, notification to the local authorized as well as to WHO, isolation, disinfection, quarantine, and then treatment is giving. Now I am going to be finished my today's lesson, but we should keep in mind that untreated pneumonic plague can be rapidly fatal. So early diagnosis and treatment is essential for survival and reduction of complication. Antibiotics and supportive therapy are effective against plague if patients are diagnosed in time. Pneumonic plague can be fatal within 18 to 24 hours of disease onset if late untreated, and this data is so much alarming with notable things. Now closing these topics, and I will come with another new topics. Till then, Allah Hafiz.